So not everybody gets diagnosed with TBI at the time of the incident on active duty, right? So sometimes it's not until many years later where you recount your history. I see this all the time with veterans that I work with, that they may not have gotten diagnosed. Hey, they had this injury while deployed. There was not good documentation, or perhaps, I've had people that were like on the Army boxing team that got struck in the head repeatedly, right? And they had different concussions throughout the years. And so it isn't until many years later sometimes that they're being evaluated at the VA or with their regular provider, and they finally get evaluated and get diagnosed with TBI residuals or long-term side effects of TBI. So what are some of those side effects? So I'm going to pull up a little VA document that I found that's kind of helpful. Hang on one second. I'm going to present this to you guys. Okay, so this is a TBI fact sheet from va.gov. Okay, so let me see if I can make it a little bit bigger here. Okay. So it basically says that the U.S. Department of Veterans Affairs provides medical and rehab services to veterans and service members with TBI. VA's polytrauma TBI system of care is a nationwide network for 110 facilities. So we already discussed what a TBI is. We talked about some TBI symptoms. This fact sheet discusses the fact that VA screens all post 9/11 veterans for possible deployment-related TBI. On their initial entry into VA healthcare, veterans with positive TBI screens are referred to specialty providers for comprehensive evaluation and to develop a plan of care as necessary. Case managers are assigned to assist veterans by coordinating services and resources to optimize rehab outcomes. And then TBI outcomes, the VA TBI model system research program tracks TBI rehab outcomes for veterans treated in the VA polytrauma rehab centers and compares these with outcomes for patients treated in the private sector. VA outcomes compare favorably to those from the civilian TBIMS and the percentages of patients discharged to home and those living independently years following rehab. Okay, so I'm going to get to some of the stuff that I use when I write reports for TBI residuals, so especially for headaches. So that's one of the most common ones I see: vertigo, dizziness, headaches, concentration difficulties, aggression, things like that. Those are pretty common as well. So, okay.